Hello, my name is Madeline. I am a junior at Grand Valley. I am a transfer student, so this is technically my first year at Grand Valley and my first year in the recreational therapy program.
And my name's Haylee. I'm also a transfer student, so this is my first year at Grand Valley as well. I'm also in the recreational therapy program.
And today we're going to be talking to you guys about IPE and IPC, which are interprofessional education and interprofessional communication, and how that sort of relates to recreational therapy and the program in itself. So we're going to go ahead and define recreational therapy for you guys, just so we can have a strong foundation for some of the other things that we're going to be talking about later. So recreational therapy is designed to help people with disabilities, and what therapists do is they take activities of leisure, work, occupation, hobbies, things like that, and they use them in clinical settings that are goal-oriented, and they try to improve quality of life and overall functioning for that individual.
So some examples of recreational therapy include sports such as wheelchair basketball, which helps make the sports more adaptive for people with disabilities. Also playing games such as board games or video games with patients to help them improve their cognitive functioning as well as reflexes.
Okay, so now we're just going to talk a little bit about how we heard about recreational therapy and sort of how we got involved. So for me, I grew up overseas in the Middle East, and having witnessed a lot of children with disabilities not being given the same opportunities as children with disabilities in the US, was really sad and hard to watch. And so ever since I came back to the United States, it was always on my heart to work in therapy. I wasn't totally sure, if it was going to be physical therapy, occupational therapy. I just knew that I wanted to help people, especially people with disabilities, be able to be involved and kind of participate in those activities that a lot of other people get to do. And not sort of have to face those same barriers that people with disabilities do.
Yeah, and the reason I got into recreational therapy was because my mom had a ruptured brain aneurysm and along with a stroke. So she had to have 3 brain surgeries to clip her aneurysms, and afterwards she had to go through multiple therapists and rehabilitation. And one of her favorite times of the day was with her recreational therapist, getting to spend time with her. And I just want to be that person for someone else and for families going through hard times and situations like that, where I can brighten their day a little bit and help them out as well in a therapeutic way.
So how we heard about Grand Valley's recreational therapy program, I believe, was through our advisors. And if you guys haven't already, I would definitely recommend talking to a counselor or an advisor. They're a great way to get connected to resources and just get a general sense of what's available to you. But I met with my advisor. We talked about what I want, my goals and my experiences, and she recommended recreational therapy. And so I went through the application process, and because of it's been sort of different from past years just because of COVID. And so the application process went pretty quickly. We got some letters of reference, some essay questions about yourself. All right, so to talk a little bit about Grand Valley's recreational therapy program, how we heard about it, how we applied. We both sort of heard about the program through our advisors, and I would definitely recommend that you students talk to an advisor, because they're great resources to sort of connect you to people that could sort of help you?
It is a secondary program, which means you have to be accepted into Grand Valley already, and then you apply to this. Kind of the same way, but a little bit of a different process. So now we're going to get into IPE and IPC within recreational therapy. And what IPE is it's interprofessional education, as Madeline mentioned earlier. And the definition of that is it's just where the members of more than one health or social care profession or both are learning together for the purpose of improving their communication within each other, and as well as the health and well-being of their patients and clients. And back to the example of my mom and her stroke, she had multiple therapists. So with them working together, learning from each other, they're not going to be in a box or in a bubble and be restricted to what they know. So learning from each other, they might be able to help answer certain questions or help guide them in a certain direction without necessarily going to that specialist. So it just intertwines them and helps them work together.
Yeah. To sort of tie into what Haylee was saying, so IPC is the interprofessional communication aspect of it. And so communication equals collaboration, and that's just where professionals from different health organizations can come together, communicate, and something that we actually just recently learned about in one of our rec therapy classes is the ICF, which is the International Classification of Functioning, Disability, and Health. Just a little sneak peek of what you guys might be learning if you guys join rec therapy. And so what it is it sets out neutral language for many health professions to use with one another so that they're on the same page. So when communicating about a patient, occupational therapists can use language that the physical therapist will understand, and they can work together on just getting the most or doing the most for that patient. So.
All right, and to wrap everything up, we just want to give you guys some tips from what we talked about in the video.
Yeah, so one of my suggestions just to facilitate interprofessional communication and education would just to go out, observe, volunteer, get as much experience as you can in different areas of the medical field. Might not necessarily be with populations that you want to work with or necessarily in the department that you want to be in, but the more experience you get, the just more able you will be to communicate with those professionals later in your career. And so,
yeah, and wherever you go or whatever you do, just get some experience, see what you like and what you don't like about it, and if that's what you really want to do, and make sure you're happy with what you're going into and with the career that you're going to have for the rest of your life.
Thanks for listening, guys.